Hello, and thank you for participating in this week's Journal Club. My name is Ben Rosenstein. I'm Geriatrics Fellow at the University of Wisconsin School of Medicine and Public Health in Madison. We'll be reviewing the article, Factors Associated with All-Cause 30-Day Mortality in Nursing Home Residents with COVID-19 by Drs. Paniatu, Kozar, Whitendahl, published January 4th of this year in JAMA Internal Medicine. This retrospective cohort study explored the question of why nursing home residents are at such an increased risk of mortality related to COVID-19. It has been well established that risk of death increases with increased age. However, characteristics unique to older adults of long-term care populations may be distinct from those of older adults in the community. This study reviewed which, if any, specific characteristics seem to place nursing home residents at particularly increased risk. The researchers studied many factors that could influence a person's risk of mortality if they have COVID-19. They looked at patient-specific characteristics, including age, gender, race, and ethnicity. They also looked at functional status, cognitive status, and comorbidities. They also reviewed disease characteristics through symptoms including fever, shortness of breath, tachycardia, and hypoxia. The results of this study were perhaps what you would expect, but also interesting. Increased age was found to significantly increase risk of 30-day mortality. Additionally, the authors showed a significant risk associated with increased functional needs and with more severe cognitive impairments. They showed a very nice dose-response-like relationship with these characteristics, as you see in the figure. The comorbidities most associated with increased mortality risk were diabetes and CKD. Similar to prior studies, they did not find a significant increased risk with those with coronary artery disease, heart failure, hypertension, asthma, or COPD. All the symptoms they looked at were associated with an increased risk, with hypoxia and shortness of breath being the most strongly associated. Interestingly, the authors did not find a significant increased risk with race ethnicity. In fact, patients who identified as Black had a lower risk of mortality in this cohort. The authors provide explanations for why this may be, and I think it's worth us exploring this further. This is, overall, I'd say a well-done study. Limitations, of course, include that it was a cohort. It was established earlier in the pandemic, so there may have been more limited testing, identification of symptoms, and reporting available. At that time, the pandemic was relatively limited to the Northeast, so not as diverse a group. Other criticisms could include that atypical symptoms, which on the other hand are perhaps more typical among older adults, were not included, though again, earlier in pandemic, these may not have been reported as much. Also, it's worth noting that age, functional status, and cognitive status are not exactly mutually exclusive, especially for older adults in a nursing home. They typically have more functional needs, they typically have greater cognitive impairments, so you might expect some of the relationships seen. However, those are not strict relationships, and so the findings are still very enlightening. In all, I'd say this study provides important information for your evaluation, prognostication, and potentially triage, especially as we continue to care for patients through the pandemic. And I hope everybody enjoys the club. Thank you.